1 in 8. That's how many women will be told they have breast cancer. It's not preventable, but it's almost 100% curable if caught early. And that's why annual screening mammograms are vital for every woman over 40. Dr. Alexander Sardiña is the Chief Medical Officer for Solis Mammography, and he's here to tell us what we need to know to stay healthy. Good morning. Nice to have you here.
Thank you for having me.
Great to have you. Okay, why are mammogram screenings so important? Just the basics.
Yeah, I think you said it in the intro. I mean, unfortunately, breast cancer is not preventable. 1 out of every 8 women will develop breast cancer. Fortunately, if detected early, it's, like you said, 100% curable. And the only thing that we have as of today to be able to detect early breast cancer is screening mammography.
Okay, as a doctor who specializes in this, what do you tell women they need to know about breast health and breast cancer?
Yeah, so I think the most important thing is understanding that annual screening should begin at 40. Secondly, I think it's really important that they understand their risk profile. So I think it's intuitive for a woman to know that, you know, if I have a mom or a sister or a daughter that has breast cancer, I inherently am at a higher risk. But there's other things that make you higher risk for breast cancer. So for example, in the African American community, younger women are developing more aggressive breast cancers. The second thing that I encourage women to understand about their risk profile is their breast density. So what we have realized over the last 5 years is that if you have a higher density of breast tissue, you have the same risk profile as a patient who has a first-degree relative. The only way to understand, absolutely, the only way to understand your breast density is by having a screening mammogram. So I encourage all women who have a mammogram to have that discussion about breast density with their physicians.
Let's talk about 3D mammography, which you offer for a second. Why is it most effective for early detection?
So I like to liken the comparison of 2D to 3D. Think of 2D as a still photograph, 3D as a high definition video.
Okay.
So with 2D, I get one view. As a radiologist, I get one view of the breast. With 3D, I get up to 50 to 60 additional images. So it kind of gives me the ability to kind of pick up the subtle changes of breast cancer.
Okay.
So if I can get a little bit scientific here, 3D has shown that it improves breast cancer detection rate by over 40%, and at the same time, it decreases unnecessary callbacks.
Wow, that's really significant.
It's absolutely significant.
You offer 3D mammography and SmartCurve comfort technology.
Right.
Can you explain that?
Sure, and we offer it at every center. So at Solis, we've spent a lot of time trying to get an understanding about compliance, right? And what's baffling is 50% of women don't get an annual mammogram. And when you think about the fact you don't need a doctor's order, if you have insurance, it's a zero out-of-pocket cost to patients. So why are 50% of women not getting a mammogram? And the short answer is pain and discomfort. So what we've done is we've partnered with our vendor, Hologic, in developing the SmartCurve, which, as you saw in the video, is a curved paddle that kind of contours to the woman's breast. So it gives us the same high-quality mammogram with less compression. Less compression, less discomfort.
I can feel the comfort when you're talking about that. I can totally understand that. Okay, what else sets Solis Mammography apart?
So Solis actually has been around since the mid-1980s. It was actually started here in Plano. And what I tell patients is, if you remember nothing about Solis, remember that everything that we do is for our patients. From the technology that we invest in, to the spa-like centers that we have, to the fact that we align ourselves with dedicated breast imagers in each market that we go to.
Thank you so much for coming in and sharing the information with us this morning. Really appreciate it.
Thank you.
You can call Solis Mammography at 866-317-8739 for more information and locations, or simply go to solismammo.com.